section.
Hi, I'm Brittany Jackson, and I'll be doing the basic IV insertion. I'm in Section 8, Term 2. I'm going to start by reading my MAR. I'm going to go over the doctor's orders, and I'm going to make sure, to see if the patient has any allergies. I'm going to pick the gauge of my needle. It's going to be 20 gauge based on the patient needs and the medication that's being given. I'm going to go ahead and draw up my saline for the saline flush and make sure it's not expired. I'm going to drop 3 milliliters of saline. And go ahead and take the needle off. We're not going to need that. And I would dispose of that in the sharps container. And open up the INT. And I can go ahead and clean this off, even though it is sterile because I just opened it up. And attach this. Get that ready. All right, now I'm ready to go into my patient's room. Knock on the door, introduce myself to the patient. I'm going to check to make sure, check patient's name and date of birth. I'm going to explain the procedure that we're going to be starting in IV, and I'm going to go ahead and pick my site. I'm going to pick the most distal site, and I'm going to pick the arm, the non-dominant arm if I can, and I'm going to ask the patient if they've had any mastectomies, fistulas. Try to pick an arm that doesn't have any bruising, let's go ahead. And I'm also going to pick a soft and bouncy, nice and soft and bouncy vein. All right, so I have my site. Now I'm going to put on my gloves. Oh, and I would have performed hand hygiene right when I came in the room. Take a tourniquet and place it 4 to 6 inches above the site. Go ahead and take the needle out. Place that right there. And get ready to clean my site. Apply the tourniquet. Because I touched that, I would get a new one. I'll go ahead and clean the site in circular outward motions. And now I'm going to stabilize the vein, and I'm going to tell my patient they're going to feel a little stick, and I'm going to go at a 15-degree angle, bevel up. And I see a blood flashback. So now I'm going to go lower and insert it completely. And release the tourniquet and apply pressure. And attach, take out the needle. And attach the INT. I would go ahead, dispose of that in the sharps container. Now go ahead and clean up my patient, any blood. Then aspirate, have blood, and then use the push-pause method for saline flush. And it's going through good, it's patent, and attach that. I'll use a piece of tape. Well, actually, let me put on I'm going to put this right over the site. And I'd make sure the patient wasn't feeling any pain. There wasn't any swelling or redness this whole time. I placed that so that it could still be viewed through the covering. And then I would take the label and I would write down the date, the time, the catheter gauge and size, and my initials, and I'd place it out of the way of the IV site. And then I would take a piece of tape and tape the tubing to the patient's arm. Then get all my supplies, throw them away, take off my gloves, and I would document the time, the date, the insertion site, how many attempts I made, the patient's response, and any instructions that I gave them. That's it.